5 things to remember about exudative epidermitis. It is also known as greasy pig disease. It is caused by a bacteria called Staphylococcus hyacus. This bacteria is present worldwide, and the disease is happening in every country that has a pig production. Staphylococcus hyacus is a commensal bacteria of the skin of the pig. Therefore, it is present in healthy as well as diseased animals. It affects younger pigs, usually less than 6 weeks of age. However, the presentation is a little bit different. In suckling pigs, usually the entire litter is affected. Gilt litters are more prone to the disease because the colostrum is less protective than the one of older sows. In weaned pigs, it is usually an entire pen or a room that is expressing clinical signs that are, however, milder than the ones in the younger pigs. Greasy pig disease starts with a scratch or a cut in the skin. Therefore, it requires a trauma that usually is due to fighting or to poor housing conditions. Therefore, pigs that are in a higher stocking density with a poor ventilation and higher humidity are more likely to develop greasy pig disease. The diagnosis is made through clinical signs. The pig will show a thickened skin, coarse hair, and also it's going to produce a lot of sebum. It's going to look really dirty, hence the name of the disease, greasy pig disease. The pathogen is also really easy to culture. Therefore, you can send skin scrapings to the diagnostic lab and will be able to isolate the bacteria. It is very important to culture Staphylococcus hyacus because there are a lot of antimicrobial resistances. Therefore, before you choose an antibiotic treatment and for it to be effective, you need to know which antibiotics the bacteria is susceptible.